The room was supposed to be quiet. Instead, it was alive with the sounds of suffering men groaning in pain, the scrape of boots on stone floors, the heavy smell of blood and infection hanging in the air. It was the middle of the night, and by the dim glow of a small oil lamp, a slender woman moved slowly from bed to bed. Soldiers watched her in silence. Some whispered prayers, others simply stared, as if afraid that blinking might make her disappear. They called her the lady with the lamp, but what most of them didn't know was that this woman was about to change the future of nursing and medicine itself forever. Florence Nightingale was born into privilege in 1820, raised in wealth, comfort, and strict Victorian expectations. She spoke several languages, studied mathematics for pleasure, and was expected to marry well and live a life of polite society. Nursing, at the time, was considered dirty work, something done by the poor, the uneducated, or women with no other options. Respectable women did not tend to the sick, especially not in hospitals filled with filth, disease, and death. Yet Florence felt something she couldn't ignore. She later described it as a calling. At just 17 years old, she believed God had spoken to her, urging her toward a life of service. Her family was horrified. Nursing? Unthinkable. They resisted for years, hoping she would outgrow the idea. She did not. Florence waited. She studied. She observed hospitals in secret. She trained wherever she could, even traveling abroad against her family's wishes. What she discovered shocked her not because she was sensitive, but because she was analytical. Hospitals weren't just places of healing. They were breeding grounds for death. Patients often died not from their injuries, but from infections caused by overcrowding, poor sanitation, and ignorance of basic hygiene. Then came the Crimean War. British soldiers were being sent to fight in a foreign land, and reports began to trickle back home, hospitals overflowing, wounded men lying in their own waste, supplies rotting, death rates soaring. Public outrage followed. The British government needed help, and Florence Nightingale was ready. In 1854, she arrived at the military hospital in Scutari with a team of nurses. What she found was worse than anything she had imagined. Rats scurried across floors. Bandages were reused without washing. Clean water was scarce. Soldiers died by the hundreds, not from battle wounds, but from cholera, dysentery, and typhus. Here's the twist. Florence wasn't welcomed as a hero. Military doctors resisted her. Some felt threatened, others dismissed her entirely. She had no official authority, yet she did something radical. She started cleaning. She demanded fresh air, clean bedding, proper waste disposal, and decent food. She focused on sanitation long before germs were fully understood. And then something extraordinary happened. The death rate plummeted. From over 40%, it dropped to nearly 2%. Not because of new medicines, not because of advanced surgeries, but because Florence Nightingale insisted on cleanliness, order, and compassion. She proved, through results, that environment mattered, that nursing care could mean the difference between life and death. But Florence didn't stop there. While others slept, she collected data. She recorded deaths, causes, and conditions meticulously. She transformed suffering into statistics. then turned those statistics into weapons for reform. Her famous diagram, simple, elegant, and devastating, showed that more soldiers were dying from preventable disease than from war injuries. Numbers, she realized, could speak louder than emotion. She took those numbers straight to the people in power, and they listened. Florence Nightingale became one of the first people to use data visualization to influence public health policy. She helped reform military hospitals, sanitation systems, and healthcare administration, not just in Britain, but across the world. Yet fame came at a cost. After returning from the war, Florence collapsed from exhaustion and illness. For decades, she lived mostly confined to her room. Some thought she had faded into obscurity. In reality, she was working harder than ever, writing reports, advising governments, mentoring nurses, and reshaping healthcare from behind the scenes. She believed nursing was both an art and a science, not just following orders, but thinking critically, observing patients, understanding patterns, advocating for dignity. She insisted that nurses be educated, disciplined, and respected. In 1860, she established the Nightingale Training School for Nurses. Graduates carried her principles around the globe, laying the foundation for modern professional nursing. And here's a lesser-known truth. Florence Nightingale wasn't always gentle. She could be sharp, demanding, and uncompromising. She believed patients' lives were too important for mediocrity. If standards weren't met, she spoke up regardless of rank or tradition. Compassion, in her eyes, did not mean weakness. It meant responsibility. She also challenged deeply held beliefs. She questioned blind obedience to doctors. She argued that nurses, because of their constant presence at the bedside, often noticed things others missed. Sound familiar? Florence understood something every nurse today knows. Healing doesn't happen only through treatment. It happens through observation, communication, and care that never clocks out. By the time she died in 1910, she had refused national honors, avoided public praise, and remained fiercely focused on her mission. Yet her legacy was impossible to ignore. She transformed nursing from an overlooked task into a respected profession. She introduced evidence-based practice before the term even existed. She showed the world that caring could be powerful and that data could save lives. Every time a nurse washes their hands before touching a patient, Florence Nightingale is there. Every time a nurse advocates for safe staffing, clean facilities, and patient dignity, Florence Nightingale is there. And every time a nurse chooses compassion in the face of exhaustion, she is there to walking quietly through the ward, lamp in hand, reminding us that nursing is not just what we do, it's who we are. She once wrote that nursing is putting the patient in the best condition for nature to act upon him. Simple words, revolutionary meaning. Florence Nightingale didn't just light the way through dark hospital corridors. She illuminated an entire profession, and the world has never been the same since.